Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Heartburn certainly is no laughing matter, and neither is indigestion. We are going to tackle both of these topics and hopefully some more so we can help you feel better about your digestive system. So Dr. Jitka Lom from Express Care is here, and we, as we always do, let's get into the science first.
Sure.
Heartburn isn't exactly having anything to do with the heart, if I
No,
understand.
not at all. It's a funny thing. You ask people, do you have heartburn, and they look confused. So your heart is in front, and behind it, right behind it, is the esophagus. And the esophagus sometimes experiences acid coming up from the stomach and it feels burny and sore. Sometimes you have burping or gas with it. But basically a burning feeling in your esophagus. Since it sits right beside your heart, people call it heartburn.
Should you induce burping if you feel like like maybe like drink a soda or something just to encourage that kind of burping?
It's not healthy one way or another. It's just something people do to relieve their discomfort.
Now, there are many over-the-counter products that one can take. There's Tums, there's Rolaids, there's Pepto-Bismol, even like that.
Right.
I would assume, not knowing anything about science, that they all generally do the same thing. But what is the main ingredient that helps treat heartburn and indigestion, and which is the best one in your opinion?
Okay. Well, if you just occasionally have heartburn, or let's just focus on heartburn. If you have occasional heartburn, it's okay to take an occasional Tums or Rolaids, which have calcium carbonate. What that is it's the calcium neutralizes the acid that's coming up from your stomach. If you eat too much calcium, you're going to get problems, constipation, you're going to have actual heart problems, and actually you kind of feed the cycle because there's a reason you're having more acid coming up into your esophagus. Usually it's because you're either overweight or you have something called a hiatal hernia, which is actually a little piece of your stomach is actually sitting up in your chest. Instead of being below the diaphragm, there's a little piece of your stomach that's kind of crept up.
Oh my goodness.
Yeah, so when you're digesting your food, the food is actually being digested slightly within your chest there. So it's quite uncomfortable. But one big reason why people have heartburn is because they're eating really spicy foods, they're taking lots of Motrin or Aleve or those type of medications, and they're also drinking a lot of alcohol. And all of that kind of it hurts your stomach lining, and it changes the way the valve functions. There's a valve between your esophagus and your stomach. That valve should stay closed so that none of that acid comes up into your stomach, into your esophagus. And if you're doing those things like the alcohol, the Aleve, and all of that, that valve will get a little loose. Now the acid will come up into your esophagus and give you heartburn.
Is that not the ultimate irony that the medicines you could take to take care of heartburn wind up giving you heart problems if you take them too much?
And then you take acid blockers to take care of that problem, and you just get into a vicious cycle of taking pills to counteract the pills that you already took before for the lifestyle problem that you started with. So your lifestyle problem being that you're eating really spicy, acidic foods, drinking alcohol, and taking these medicines.
So like most things that Dr. Lom has told us on the program, change your lifestyle for the better.
Unfortunately, that's really the best way to deal with digestive problems.
Okay, so indigestion, we'll get to that now. Well, what is indigestion, and what can one do to avoid it, and what should one take if they have it?
Right, so with indigestion, that's sort of more of a vague area where people may talk about heartburn like we just did, or they may also be talking about burping or basically just an uncomfortable feeling in their tummy when they eat. And this may be related again to the kinds of foods that they're eating, very greasy foods, very heavy foods, foods that are highly processed. And oftentimes it's related actually to constipation, where people aren't moving their bowels nicely, and so there's sort of stagnation happening in the intestines. So then there'll be a lot of gas buildup and a lot of burping, and also a lot of wind going the other way. So indigestion, again, it's related to food, the regularity of your meals. Many people don't eat regularly. They just sort of skip breakfast, get hungry at lunchtime, then eat a giant meal at dinner. Those type of things are usually not that healthy for your digestive tract. So back to your question of what can you do? Try to eat small, regular meals, okay, at regular times. Try not to overeat one food group. Try to have, your vegetables, your fruits, a small amount of protein, a little bit of starch, not too much, so that you basically are balancing everything. If you notice that there's a certain food that upsets your stomach, don't eat it anymore. If it's, for example, milk.
Simple as that.
Simple.
To repeat actions that bring about an otherwise negative response is the very definition of stupidity.
Well, it's not so much stupid. It's just that people really, really love these foods. You know, they're not trying to hurt themselves. They just really love the food. They love the spicy food, or they love the ice cream that gives them the upset stomach. Chocolate, what a classic. Chocolate will give you heartburn very frequently, or you know, upset your stomach. So you have to watch and see what it is that you're eating and try to balance that out and drink lots of water. Again, most people eat food to become hydrated because they're not drinking enough water, so they try to get the water content out of the food. So you want to eat those small regular meals, try not to eat too late at nighttime for indigestion, and then also moving. You physically have to move your body. You know, when we eat, we're sitting when we eat, right? That's not really that great for helping our intestines move. So we need to get up and take a little walk afterwards so that our digestion will stay good.
Now we got to go to commercial, and we got about 30 seconds now, but I wanted to just throw something else in there. Is the position of your body when you eat, because I know people that will literally like lie on their back, watch TV, and eat an entire plate of spaghetti and meatballs.
Obviously, it's
does that contribute to heartburn and indigestion?
Of course, it's very difficult for things to digest if you're going this way. Even
it's all gravity.
Right, even in the hospital, you know, we try to sit patients up, try to help them eat that way. It's very hard for them to digest the other way. Back to your question about what other things could you do to help your digestion. You can actually purchase what's called digestive enzymes. These are enzymes that you can buy at a vitamin store that help you digest your food, and you can take them right before your meal and take it, you know, 1 or 2 tablets and with each meal, and after a few days you'll start to notice that you feel better. But prior to doing that, you'd want to do a nice clean out, meaning drink some prune juice or take some senna or some other laxative type of thing. Not that you want to do that frequently, but just once or twice to just really clean everything out. And then you're going to start with your nice frequent small meals, and you'll feel so much better, because people feel so bloated from just being so full, you know.
All right, very well. Well, stay tuned, because we will have the doctor back. More questions about digestive system complications after this.